A very common mental health issue we see with teens and adolescents is depression. And it's important that you know, as the person with the influence in the athlete's life, to look for important warning signs that might alert us to when depression is occurring or when there might be a risk for a suicide attempt. These warning signs are not to alarm or scare you, and if any one warning sign is present, that's okay. It doesn't mean that that student is automatically going to feel suicidal or fall into a deep depression. But if you see several of these warning signs occurring, you might want to check in on that student. Some of the warning signs could include drug or alcohol use, a major life event, a major life transition, so maybe a relocation of the family, a divorce, financial change in the family situation, a loss of a relationship, a death of a family member. These are examples of that major life trauma or transition that occur. Other warning signs could be a significant injury, a team demotion, so someone who maybe was getting a lot of playing time or able to participate in all the activities suddenly now isn't performing as well or isn't upholding their usual standard of behavior. Social isolation is another warning sign, and bullying. Those can be triggers for depressed mood. And it's important that you know that anytime there's a major change in a student's behavior or appearance, any major change one way or the other can sometimes be a warning sign that something's not right. This could include mood. So if you have a student who's normally bubbly and cheerful and suddenly they come in sullen and not making eye contact and isolating themselves, that's a major change in that student's behavior, and that could be a warning sign. Other major changes in sleep, if they're not needing any sleep or they're sleeping too much, that could be an indication. Also, a major change in appetite or hygiene. If you see a student who's normally able to take pretty good care of themselves coming in with dirty clothes, unshowered, that might be an indication that something is happening to their mood. And anytime an athlete is giving away their possessions or talking about death and dying or talking about being a burden to the people they love, that's a pretty big warning sign that something might be going on. With athletes, though, it's sometimes difficult to identify mental health concerns. They have been taught throughout their lives what it means to be tough, what it means to be weak, and sometimes they can interpret that as, I can't share that I'm hurting, or I can't share that I'm anxious or depressed because then I'd be weak, or then I wouldn't be as strong and tough as I've always been. So that causes an athlete to hide or mask their mental health struggles. And also, athletes have to attend practice. So we traditionally think of depression as someone who is just alone in their bed, sleeping all day, they can't get up. But with athletes, this isn't the case. If they don't go to practice, they can't play in the game. Or if a student doesn't attend their activity meeting, they won't be able to travel to that activity or event. So they have to do these things. They have to get themselves up and go to practice. So we might assume that they're doing well and there's no problems in their life. So that makes it tricky when dealing with students who are experts at masking their problems. So you, as the influential adult in their life, knowing these changes in behaviors can help you to more easily and more quickly identify when a student is having a difficult time. So overall, it's really important for you to be looking for drastic and uncharacteristic changes in behavior or reduction in performance, inability to maintain attention to the task, decreased energy and motivation. Sometimes with teen and adolescents, they can become angry and have outbursts. They could argue with their friends or fight. And these might be indications that something else is going on also. For young men, anger sometimes is what they show to the world when they're feeling sad and depressed. So anger outbursts, fighting, punching walls, those can all be an indication that something's going wrong. And of course, if you see any visible signs of self-harm, such as cut marks, burn marks, or bruising, that's important to follow up on as well. And if you aren't sure if a student is at risk of harming themselves, or if you aren't sure if a student is depressed, ask them. Go to the student in private and say, are you feeling suicidal? I know that's a scary thing to consider doing. That S word can be scary, but trust me, you will not do harm by asking. you're giving that student the message that I care about you, I care about how you're doing, and if you're having these thoughts, I am someone you can talk to about it. We sometimes think that if we introduce the idea of suicide, that this might create those thoughts for students, but that is not the case. It opens up a big door where that student can unload or offload their pain and hurt to someone. It's a heavy task to consider, being told that kind of thing. So if a student does say, yes, I am having thoughts of hurting myself, then you would immediately get that student to licensed mental health professional. So this could look like a variety of resources. If you have a school counselor, that's a great place to go. If you have a school nurse, taking the student to the school nurse would be a great idea. And if you're in a more rural area of Kansas, there has to be some physician or medical provider in that area, and that is a great place to take a student that you might be concerned about. And as always, we have to inform parents and get them involved. And so now I'm going to talk about risk and how to recognize maybe if a situation is an emergency and down to maybe a low-risk situations. So examples of emergency situations would be if a student has done something to harm themselves. This could look like ingested medication, ingested poison, they have a weapon, or they're having any hallucinations or delusions, or they've lost touch with reality. If they are at imminent risk of harm, that is an emergency situation, and you would call 911 or take them to the emergency department immediately. Some lower level risks, and this is the confusing part, this kind of medium level of it's urgent, but it might not be an emergency situation. These would include the panic attack, or the student has maybe some thoughts of wanting to escape, or I just want to drive away, I want to escape my problems. So they don't have an active plan for harming themselves, but they're not doing well and they need some additional support. This is a case where you would take this student to the school nurse again, or to the school counselor to help them get some long-term care and therapy. Less urgent and low-risk situations would be maybe some breakup with a girlfriend or a boyfriend, or not doing well in a class that's causing some distress for a student, but the risk is not immediate. So there's not an immediate concern that needs to be addressed in that moment. And these are cases where you would want to encourage and connect that student with a counselor. Make sure you know and follow your school's mental health emergency action plan. This information is not meant to supersede any of the plan your school already has in place. If your school does not have a mental health emergency action plan, this might be a good time for you to talk to administration and to other activity directors to come up with a plan for your school. And again, we are not encouraging you to make any medical decisions. So if there's any concern at all about an emergency or a risk of the safety of the student, take them to a medical professional or an emergency department.